Hello everyone, I'm Anas Al-Ubaidi, and the topic for this session or the topic for this lecture is Advanced Outpatient Medicine Review and SOAP or SOAP templates. This lecture or this session is within chapter 26, which is about review of family medicine and outpatient scribing within the Certified Medical Administrative Assistant Program by ACMSO. Introduction. Outpatient medicine represents the foundation of long-term, preventive, and follow-up care for countless patients. Unlike inpatient settings, outpatient care typically involves shorter, focused visits aimed at diagnosing conditions, monitoring existing health issues, and implementing tailored treatment plans. The role of advanced medical scribes in managing outpatient documentation is critical, as they ensure that each encounter is accurately and comprehensively documented, providing an essential framework for continuity of care. For medical scribes, mastering the nuances of outpatient practice is vital to facilitating smooth workflows and supporting both providers and patients. At the heart of effective outpatient documentation lies the SOAP or SOAP format, which is short for Subjective Objective Assessment and Plan. This universally recognized structure serves as the backbone of medical notes, providing a cohesive framework for organizing patient encounters. SOAP, which is again SOAP, short for Subjective Objective Assessment and Plan, templates, guides, scribes, and methodically recording information, starting from the patient's reported symptoms, subjective, and combining that with measurable clinical findings, objective. These are then synthesized to form a medical narrative that leads to diagnosis, assessment, and treatment strategy plan. The clarity and logical flow of SOAP or SOAP notes are indispensable in outpatient medicine where efficiency and accuracy are paramount. Outpatient settings are uniquely demanding due to their high patient volumes and time-constrained encounters. Providers often rely on scribes to capture extensive details in real time, ensuring notes are both complete and compliant with medical standards. A single missed detail, be it an allergy, a recent lab result, or a key element of the physical exam, could impact patient outcomes, making precise documentation an absolute necessity. SOAP or SOAP templates are also enable continuity of care across encounters by organizing patient histories in a structured manner that facilitates comparative analysis and decision making. As for example, a series of SOAP notes from hypertension follow-up visits allows the provider to track trends in blood pressure, assess the effectiveness of medication, and adjust treatment based on ongoing observations. Additionally, well-executed SOAP notes reduce the cognitive load on providers by ensuring they are fully informed on previous diagnoses, interventions, and patient feedback without needing to comb through disorganized records. The integration of SOAP templates into outpatient workflows also carries broader implications for training medical scribes. By adopting this method, scribes gain proficiency not only in fast and accurate documentation, but also in recognizing patterns in medical decision making. This skill set prepares advanced scribes to anticipate provider needs, prioritize clinically significant details, and maintain compliance with regulatory and billing standards, a critical component of outpatient medicine. Key points. We have the structure of SOAP notes. Subjective section. The subjective section serves as the foundation for patient encounters, capturing information directly from the patient. This includes their chief complaint, CC, the history of present illness, HPI, and any additional subjective inputs such as family history, past medical history, or social factors that impact care. Example, a patient presenting with back pain might provide key details such as pain started 2 weeks ago while lifting heavy objects, worsens after physical activity, and improves with rest. This information is vital for the provider to narrow down potential causes and initiate appropriate care. Objective section. The objective aspect includes measurable or observable clinical data such as findings from the physical examination, diagnostic tests, and vital signs. This section focuses on factual, non-interpretive data recorded during the encounter. Example, for the same patient with back pain. The objective section may include tenderness over lumbar spine, no neurological deficits, normal range of motion in lower extremities. These observations provide a baseline for the assessment and correlate with the patient's complaints. Here's a summarized diagram summarizing the SOAP note process right here in this slide. Assessment section. Here the healthcare provider synthesizes data from both the subjective and objective sections to form a diagnosis or rule out potential conditions. Scribes document the provider's clinical reasoning and updates to the patient's problem list. Example, the patient's back pain could lead to an assessment such as mechanical low back pain, consider lumbar strain, differential includes disc herniation versus muscle spasm. The summary reflects the provider's thought process and sets the stage for patient management. Plan section. The plan outlines the next steps in the patient's care. This may include prescribing medications, recommending physical therapy, ordering further diagnostics, and scheduling follow-ups. For chronic conditions, the plan often includes patient education and self-management strategies. Example, the patient with back pain may have a plan stating start ibuprofen 400 mg every 8 hours as needed, suggest physical therapy for core strengthening, order lumbar x-ray if symptoms persist. Follow up in 2 weeks. Clarifying the plan ensures continuity and clarity for the patient and healthcare team. Here is a summarized diagram summarizing the patient care process in healthcare right here in this slide. Organizing patient encounters. We have a clear documentation as SOAP notes help the scribes document encounters in an organized and logical way, allowing the provider to quickly grasp the key details of the visit. The clarity reduces the chances of errors or omissions. Because, for example, a scribe uses the SOAP format to record a patient's routine diabetes follow-up, ensuring all aspects from symptoms like increased thirst to objective labs showing HbA1c of 8.7% are included. A focused assessment such as uncontrolled type 2 diabetes leads to a plan on medication adjustments and dietary counseling. Streamlined workflows with high patient volumes in outpatient settings, scribes must document efficiently to maintain workflow timing. SOAP templates increase speed by standardizing note structures, ensuring no section is skipped and focusing on clinical priorities. Example, using a pre-configured EHR SOAP, electronic health record SOAP template for hypertension follow-up visits ensures the encounter captures all required documentation, such as blood pressure readings, adherence to medication, and lifestyle counseling without wasting time. Reducing cognitive load for providers. Scribes also help reduce provider workload by organizing information logically using SOAP. This allows providers to focus on patient care instead of sifting through unstructured records. Example, instead of manually piecing together the patient's history, the doctor or the clinician can rely on the scribe SOAP note to instantly review relevant details and make decisions during the visit itself. Impact on clinical decision making. Supporting evidence-based care. A well-crafted SOAP note includes all the necessary data to guide clinical decisions. It ensures that every decision is supported by patient-reported data, subjective, measurable findings, objective, and well-reasoned assessments. Example, a patient presenting with chronic cough might have documentation stating cough worsening over 3 months. No fever, history of smoking 15 years, subjective, clear chest x-ray, PFTs, pulmonary function test available in chart, objective. Combined, these findings support the assessment of probable COPD, chronic obstructive pulmonary disease, and a plan for spirometry confirmation and treatment. Tracking trends over time. As SOAP or SOAP notes create a system of tracking changes in a patient's condition across multiple visits. This makes it easier for the provider to determine the effectiveness of treatments and adjust care plans accordingly. Example, a patient's hypertension SOAP SOAP note might highlight improved blood pressure measurements after starting a new medication, supporting its continuation. Future notes provide a comparative view of the condition's progress, highlighting actionable key points. Through the SOAP framework, scribes learn to prioritize clinically significant details that help providers or clinicians quickly identify potential red flags or follow-up actions. Example, a note on a patient recovering from pneumonia includes actionable items such as persistent crackles in the left lung base requiring follow-up imaging. This structured approach ensures no critical detail is overlooked. Ensuring continuity of care. Standardizing documentation across encounters. SOAP notes provide a standard structure that ensures consistency across patient visits. This continuity is crucial for long-term management of chronic and complex conditions. Example, diabetic patients' SOAP SOAP notes spanning several months show consistent documentation of glucose levels, lifestyle changes, and medication adjustments. This cumulative record helps refine the plan moving forward. Facilitating handoff communication. Clear and consistent SOAP SOAP notes are invaluable during transitions of care between providers. They act as an accessible reference, reducing misunderstandings about the patient's treatment history or current status. Example, a primary care physician, a PCP, referring a patient with newly diagnosed cognitive heart failure, CHF, to a cardiologist ensures that the SOAP note details symptoms leading to the initial diagnosis and steps already taken, streamlining the cardiologist's care approach. Enhancing patient safety. Accurate and structured SOAP notes minimize errors that might arise from unclear or incomplete documentation. This ensures major clinical decisions are based on well-documented evidence. Example, a scribe's addition of allergy documentation in the subjective section avoids the accidental prescription of penicillin to a patient with a known reaction, safeguarding their safety. Next, we have the summary tables. As here, we have a table on core components of SOAP notes section, purpose, example, rule and care, risk of neglect sections. We have subjective, objective assessment plan, and follow-up. Table on benefits of SOAP notes in outpatient medicine. Benefits description, example, added value challenge. Benefits standardization, consistency, improved efficiency, patient-centric care, better communication. Table on challenges and effective SOAP implementation challenge, explanation, example, impact or documentation, mitigation strategy challenges, overgeneralization, time constraints, data duplication, diagnostic ambiguity, and follow-up gaps. Table on clinical decision making with SOAP notes, aspect description, example, benefit, consequences of neglect aspects. We have evidence-based care, holistic evaluation, treatment tracking, patient tailoring, and risk reduction. Table on tools and resources for effective SOAP documentation. Tool purpose, example, impact challenges. Tools, pre-configured templates, dictation software, training guidelines, real-time checklists, analytics in EHR, electronic health record. Next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Which of the following is the primary purpose of a SOAP notes subjective section? A. Recording measurable findings obtaining during a physical exam. This would be objective. B. Summarizing clinical reasoning used to establish a diagnosis. C. Capturing patient-reported symptoms and medical history. Or D. Outlining next steps in the patient treatment plan. And this would be plan. The answer here would be C. Capturing patient-reported symptoms and medical history. This would be subjective. The subjective section documents the patient's complaints, symptom descriptions, and relevant medical, family, and social history. This input forms the foundation for the subsequent stages of documentation and assessment. Question 2. What data would be most appropriately included in the objective section of a SOAP note? A. Patient reports prolonged fatigue after physical activity. B. Left ankle swollen with decreased range of motion noted on examination. C. Recommended follow-up in 2 weeks with physical therapy. Or D. Possible causes include sprain or fracture. The answer would be B. Left ankle swelling with decreased range of motion noted on examination. The objective section focuses on measurable and observable findings such as physical exam results, vital signs, and diagnostic data. Observable characteristics like swelling and limited range of motion are appropriately documented here. Question 3. Why is the assessment section critical for clinical decision making? A. It details only the measurable findings from diagnostic tests. B. It provides a clear synthesis of symptoms, findings, and potential diagnosis. C. It outlines the future steps a patient should take for their condition. Or D. It records unstructured notes about the clinical encounter. It is B, as it provides a clear synthesis of symptoms, findings, and potential diagnoses. The assessment section combines subjective and objective inputs to identify diagnoses or hypotheses. It supports clinical reasoning by documenting how each symptom or finding leads to potential diagnoses, ensuring an informed treatment approach. Question 4. How do SOAP templates enhance continuity of care in outpatient settings? A. By eliminating the need to track trends across multiple patient visits. B. By standardizing the structure of notes. 2. Provide a clear historical record. C. By discouraging physicians from adding personalized care details. Or D. By prioritizing documentation of administrative metrics over clinical finding. It is B. By standardizing the structure of notes to provide a clear historical record. The structured format of SOAP allows the providers or clinicians to assess consistent and organized records for each patient, making it easier to track long-term trends and ensure alignment with ongoing treatment plans. Question 5. If a scribe fails to include specific next steps in the plan section, what consequence is most likely? A. Providers or clinicians will need to guess the patient's follow-up requirements. B. Measurable findings in the objective section may become inaccurate. C. The subjective section will automatically correct the omission. Or D. The diagnosis listed in the assessment section will be invalid. The answer is A, as here the providers will need to guess the patient's follow-up requirements, as the plan section specifies actionable next steps, such as orders for tests, prescriptions, or follow-ups. Omitting key details could cause confusion among healthcare providers and interfere with patient care continuity. And here we come to end of this lecture. Thank you very much and goodbye.